Hello, Barnstormers. I hope all of you and your families are doing well during this very difficult time for our nation, our state, and our wing. We are facing an unprecedented health emergency. Every day, we are getting guidance down from the CDCs that we take into account and how we can take a look and reduce the risk to our members and our mission. As part of my outreach to all of you, today, through this town hall format, I'm going to answer some of the questions that you wrote in and would like to know more about. The first question deals with, what would it take for me to take the wing from its current HPCon Charlie Plus to HPCon Delta? I would like to introduce to you Major Jones, our wing public health officer, who will actually explain to you some of the things that she's looking at from public health data that would take into account her recommendation to me to take our wing to HPCon Delta.
Hi Barnstormers, I'm Major Barbara Jones and I'm the Public Health Officer here at Barnes. In the civilian world, I'm a veterinarian with a Master in Public Health and I'm a boarded specialist with the American College of Veterinary Preventative Medicine, which covers the areas of infectious disease and epidemiology, as well as others. We are here to take care of you and your family, as well as protect the mission. We are currently looking at the data and trending for the state of Massachusetts, Hampden County, Westfield, as well as surrounding states, in order to give advice and recommendations to Colonel Green. The trends for triggering HPCon Delta, there's 3 triggers we are looking for. So the first trigger will be an absolute number of positive cases on Barnes. The second is a percent increase in a 24-hour period. And the third trigger is a total percent increase that we have had at Barnes. As of right now, there's no reason to go to HPCon Delta, and if there is one of those triggers met, we will advise Colonel Green at that time.
Okay, Barnstormers, let's get to your next question. What will be the impact of the modification from Charlie Plus to Delta? In your last email, you stated we would modify our personnel to mission essential personnel only. What does that mean? Well, you just heard Major Jones talk to you about some of the conditions and issues that she's looking at as our public health officer. I would take all those into account. And then, if the situation dictated for us to go to HPCon Delta, I would get to what we call mission essential personnel only. Now, that term has to be explained a little bit. When I say mission personnel only, essential personnel only, it's in the context of our current pandemic and our response. It's not the same if we had a snowstorm where at that point, all I need in right now are all the folks that I need to be able to clear the runways, the parking lots, the buildings, and making sure that our alert mission can be viable for our nation. In this case, it's a little bit more complicated because I need to make sure that I'm taking care of you as well. And taking care of you means right now making sure that I have as many of you as possible at home, staying healthy, practicing social distancing here, and ensuring that you can be recalled if necessary. So mission essential personnel only for our current operations means that just those people I need and the equipment that I need to make sure that I can keep the alert mission running. I can spin up the rest of our fleet if necessary, if required to, in the shortest amount of time possible. So literally exposing the least amount of people out here to the base as possible. That's what I mean about mission essential. Now let's get to the next question. Are there any assets that the base is donating or already has donated to local healthcare facilities? Great question. A lot of private companies are doing just that right now, and it really is inspiring to see them do that. Our main mission and role right now is to be ready to respond to the call from our state. As you know, many members in our Mass National Guard are responding throughout the Commonwealth for missions to help take care of the people and the cities and towns. We are here doing the same thing. We have many members now that are out doing missions for our Task Force Minuteman. And so the equipment that we have right now and the vehicles that we have right now are all geared towards being ready to respond when called for. And so no, we aren't currently doing anything else other than being ready for those future missions that we anticipate through this long duration of this coronavirus response. Let's get to the next question. Aside from the people activated, are there services here that are being utilized to contribute to our community? i.e. life support sewing masks or vehicles being provided to deliver meals to those in need? Well, it kind of dovetails on my last answer in the last question, is right now all of our resources, all of our people are here responding to each mission that we're given to go out and support Task Force Minuteman and help the Commonwealth and the cities and towns with the issues that they're facing. So although we're not participating like a lot of our community and private sector partners are, we are taking a vital role as the National Guard, as you have always done in the past. As I said, we are the National Guard, and we have a role both for the nation and for our state. And right now, we are doing both. We are maintaining alert and making sure that that's always there for our nation, while at the same time using our members in a state active duty status to go out and support the needs of the Commonwealth. What I need from all of you is to stay home, stay healthy, continue to practice social distancing. As I've said to you, it's going to be a little bit more time here before we get over the curve and come back on the backside of the slope on this issue. I need you ready and available if called. So take care of yourself, take care of your family, and be ready and available if we need you. Go Barnstormers.